Welcome to the Undercurrent. I'm Lauren Windsor. We are here with Michele Johnson, who is the co-founder and executive director of the Tennessee Justice Center. We are at the Families USA Health Conference in Washington, D.C. Thank you for taking the time to speak with us today.
Absolutely. Thanks for having me.
So the focus of your work is on accessibility to healthcare for children and also youth in general. With the implementation of the ACA, do we see expanded coverage for those groups?
Yeah, in Tennessee, right now we do see a little bit of expanded coverage, but our children had been covered. It's their parents that we're really most worried about in Tennessee, and of course, children fare better if their parents are covered. And our governor has chosen not to expand Medicaid. That's going to have a huge impact on the people of Tennessee.
So what's your strategy in the coming year to pressure the governor to expand Medicaid in the state?
Really just making sure that the citizens know what that means. They know that $6.6 billion of their federal tax revenue is going to be going to other states, and they know that when hospitals start closing, and they're oftentimes the biggest employer in rural communities, that's because our governor said no thank you to the federal funds. Our governor has tried to blame his failure to expand Medicaid on the Obama administration, and that's really smoke and mirrors. He hasn't asked the Obama administration for a plan, and so basically we're hoping to educate the public, because about 63% of Tennesseans already want a Medicaid expansion, and we really think if people understood the facts, it would be overwhelming. And similar to Kentucky, where 80% of those people want the Medicaid expansion, they're seeing the benefits of it in Kentucky, just our neighbor to the north.
So what would Medicaid expansion mean for Tennesseans? Like, how many more people would be covered?
About 330,000 people, but more importantly is that it would mean jobs would be generated. About 17,000 jobs would be generated, and it would stop hospitals from closing, which would mean jobs would be saved. And if those hospitals close, there's about 27 hospitals estimated that might close from this. That is really going to blow a hole in our healthcare infrastructure. It's going to keep people in those communities, whether they're privately insured or very wealthy, from accessing care, because there's not going to be a hospital there anymore.
So in terms of implementation, the big story was like the botched rollout of the website. But post, the website fixes, what does implementation look like? Is it a success? Are young people registering in enough numbers to make a significant impact, the critical impact that has to be made in order for Obamacare to work?
Yeah, so in Tennessee, there's been a lot of poutiness with state officials. And so, for an example, they closed the state offices that determine eligibility for folks on Medicaid. And so generally people come there to access coverage, and they're being told they need to go to marketplace, go to the marketplace to get coverage. So right now we're not seeing the benefits that the law should have on our people because of the attitude of state officials. We're hoping that can change. So we can actually get people covered who need to be covered. So we have more and more people who are getting on straight through the marketplace, but then we have these 300,000 people who can't get coverage because of the governor's decision, and then we have another about 120,000 people who are eligible but unenrolled for Medicaid. And if those folks come forward to enroll, there's just nobody to help them. They're telling them go to a computer with no help, and that doesn't really work for folks for a variety of reasons. They're not used to computers. They're not sophisticated. They need in-person assistance, and so we're struggling to make the promise of the law real for our citizens.
Well, best of luck to you, and thank you for taking the time to speak with us today.
Good. Thanks so much.
Undercurrent under the surface makes the mainstream get so nervous. It's time for purpose, for news to serve us, not with propaganda they use.